The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Coming up on Today's Health, a scale that can measure body fat percentage in your own home. New options for people with multiple sclerosis. The importance of a good cough. A gland condition that can cause high cholesterol, heart disease, and infertility. Modern medicine for an age-old problem, faulty wiring in the heart. Home test kits for people who rely on blood thinners. And a quick, effective procedure to relieve chronic back pain. That's right now on Today's Health. Today's program is brought to you in part by Tanita Corporation of America, Incorporated, Tiva Neuroscience, Abbott Laboratories, Adams Laboratories Incorporated, St. Jude Medical, Roche Diagnostics, and ArthroCare.
Each one of us is a unique individual, and there are many different factors that can determine what our health needs are. Hi, I'm Chris Everett, welcoming you to Today's Health, the show that gets right to the heart of matters concerning your health. Issues such as age, gender, lifestyle, and family history can all present health risk factors that we may not be aware of.
Today, more Americans than ever are either overweight or obese. It's becoming a health problem of epidemic proportions.
We've all been through the dreaded weigh-in during our physical at the doctor's office. It seems that no matter how much we diet or exercise, we can't get to that weight we're told we should be at.
And being overweight isn't the only potential problem. A person may have an acceptable weight and figure, but if their body contains too much or too little body fat, their health could be at risk.
Body fat is vital to daily body functions. Actually, body fat serves as the insulation both in our brain cells and for body temperature regulation. It's what our cell membranes are made up of, and it stores vitamins in the body.
Most people have come to realize that a better diet will yield a healthier body and increased longevity. The USDA recommends lowering our daily caloric intake in order to lose body fat. It's important to remember that all calories not used through the day are stored in the body as fat. Designing a diet tailored for your particular lifestyle and food preferences is key to getting your body fat content where it needs to be.
What most people don't realize is that fat content is a better indication of fitness than weight. The weight charts we use were designed by insurance companies to establish recommended weight ranges for men and women. Unfortunately, these studies do not accurately represent a cross-section of the entire American population.
Traditionally, the measurement of body fat has been a rather inexact science. We have caliper measurements, which measure the skin folds at various points in the body. We have used underwater weighing, which is rather inconvenient. Today we have more expensive body scans, but they are pretty much used in hospital and clinic settings.
Now there's a fairly new, inexpensive method available that can be used right in your home. Tanita Corporation makes several scales that use BIA, or bioelectric impedance, to determine body fat percentage. They work by passing a low-level, safe electrical signal through the body. Impedance is greatest in fat tissue, which contains only 10 to 20% water. By using the impedance measurements along with a person's height, weight, gender, age, and fitness level, Tanita's Scale Plus body fat monitors calculate the percentage of body fat. Some models also calculate daily caloric intake. For more information about Tanita's Scale Plus body fat monitors, log on to www.tanita.com.
Being healthy and looking good isn't just about hitting a specific weight. With the right tools, you can gain perspective and lose the worry.
A serious illness requires serious attention. If you or a loved one are faced with major health issues, then this next story may shed new light on your difficult situation.
Multiple sclerosis, or MS, is a disease that has a tremendous impact on the lives of those it affects.
Imagine a life where, for no apparent reason, you lose your balance and then return to normal. How could you perform at work if you were overcome by severe fatigue? For thousands of Americans with MS, these symptoms and others are all too real.
MS is believed to be an autoimmune disease that damages or destroys the ability of our nerves to send and receive electrical impulses to and from our brain, causing a wide variety of symptoms to occur. The most prevalent type of MS is called relapsing remitting, accounting for roughly 85% of all cases at initial diagnosis. In relapsing remitting MS, patients experience symptoms for a period of time, and then these symptoms go into remission. Invariably, patients with this type of MS will have a relapse of these symptoms or develop new symptoms in the future. If the disease is diagnosed in its early stages, there is help available.
Since the advent of the immunomodulatory drug therapies that have become available during this past decade, our patients' lives with relapsing remitting multiple sclerosis have been greatly improved. Early treatment with these therapies have altered the course of their disease.
When discussing treatment options for relapsing remitting MS with your doctor, it is important to consider these factors: safety, tolerability, how the drug is administered, and how the treatment fits into your lifestyle.
Many people discontinue their therapy because of side effects. For example, 78% of people with MS experience fatigue, and some treatments for the disease can cause an increase in fatigue, as well as flu and depression.
There is good news, however. Some therapies are showing promise in treating MS without such side effects. This may help more patients to continue treatment and experience a sustained reduction in symptoms.
Since taking the medication now, I am 100% better. My mobility, my flexibility, my attitude is better. I am more coherent, more alert, and I know that it's working.
Even well-tolerated therapies have some side effects. The key is finding a treatment you can stick with. For more information on therapies and on living with MS, you can log on to www.mswatch.com.
Successfully managing relapses can add predictability to the lives of people living with this type of MS, allowing them to spend less time dealing with their illness and more time enjoying life.
When today's health continues, if you're battling a cold this winter, we'll see why it's important to make the most of your cough. And could you be at risk for a gland condition that can cause high cholesterol, heart disease, and infertility? That's coming up in just a moment.
As time passes, the effects of aging can present a variety of health challenges. Knowing what our options are can help us maintain a good quality of life as we enter into our golden years.
Do you know what your thyroid gland does? Well, if not, then you should. It's estimated that nearly 28 million people living in the U.S. have thyroid disease. That's 1 out of every 10 people. The most common form of thyroid disease is hypothyroidism, or underactive thyroid, and women are especially at risk.
Although hypothyroidism can strike women at any age, it becomes more common in women 35 years of age and older.
Some reports estimate that 1 out of every 8 women will develop thyroid disease at some point in their lives. If left untreated, even mild thyroid failure can lead to elevated cholesterol levels, heart disease, depression, osteoporosis, and even infertility.
The thyroid gland is a small butterfly-shaped organ located in the center of the neck. The purpose of the thyroid gland is to produce something called thyroid hormone. Thyroid hormone seems to regulate the metabolism of each cell. We know that when the levels are normal, the cell functions fine and the person has no symptoms at all. When the levels are too high or when the levels are too low, the person knows that there is something wrong because thyroid hormone has its effect on virtually every cell and every organ in the body.
The good news is that thyroid disease can be treated. In the case of hypothyroidism, the most common treatment is thyroid hormone replacement therapy with levothyroxine sodium. Because the symptoms of hypothyroidism often resemble the signs of normal aging, this disease often goes undetected. Common symptoms of hypothyroidism may include tiredness, forgetfulness, hair loss, unexplained weight gain, cold intolerance, dry skin, and heavy menses.
We're very fortunate in this particular area of endocrinology in that we have a very sensitive, easily available, relatively inexpensive test that can be obtained in virtually every physician's office. This test is called thyroid stimulating hormone, also going by the initials TSH. When the TSH level is high, hypothyroidism or underactive thyroid is diagnosed.
Thyroid disease can be serious, but with proper testing, early diagnosis, and appropriate treatment, most people with hypothyroidism still go on to live normal lives. You can learn more about thyroid disease, its symptoms and treatment by logging on to www.thyroidinformation.com.
Remember that untreated thyroid disease can lead to other serious health risks. So if you think you're at risk, talk to your doctor and ask for a TSH test.
No matter how well we take care of ourselves, new health challenges can arise at any time. That's why it's essential to keep informed about the latest advances in science and health. Here's a significant advance that could be of importance to you or someone you know.
As the cold and flu season goes into full swing, we all know what's in store for us. The familiar scratchy throat, runny nose, coughing, and sneezing. We call this the common cold because everyone gets it. But although common, these infections are not necessarily benign. Complications can arise if proper medications aren't taken to control symptoms.
Colds, flu, and bronchitis are the largest causes of illness in the U.S., accounting for about half of all illness in general and 75% of ailments in children. Most infections last for a week or two, with influenza viruses more long-term and more severe than colds. The amount of time lost per year really adds up, about 30 million workdays and 30 million school days. The total cost of non-prescription drugs used to treat colds and flu is at least $4 billion per year. Doctors refer to this large family of viruses overall as upper respiratory illness, or URIs. URIs are usually caused by viral infections of the body's upper respiratory tract, although allergies and bacterial infections can cause similar symptoms. They occur with fairly predictable regularity in the population according to season. We usually get them from hand contact, like shaking hands, or by breathing in viruses from the air. The infection frequently starts with a scratchy throat, followed by nasal drainage and coughing. Coughs usually become bothersome on the 4th or 5th day of illness, but they are necessary to get better. Coughing is the most powerful method our lungs have to protect themselves from infection. In effect, coughing is the first line of defense in maintaining lung hygiene. Mucus, which lines our lungs, is beneficial in many ways. It acts as a barrier to prevent irritant particles from invading the lungs. It also helps remove and transport infections away from the respiratory system. But many patients with URIs and bronchitis experience dry, unproductive coughs caused by extremely thick mucus that is difficult to expel. If this mucus collects in the lungs, bacteria might breed there, causing further infection and inflammation. That's why doctors sometimes prescribe a medication that can thin out these thick respiratory tract secretions to make coughing more productive.
Mucinex has now been approved as by the FDA as a long-acting product with a new delivery system that has a short-acting form as well as a long-acting release system to a short 12-hour delivery.
This is important information to know as we approach the peak of the cold and flu season. Although we may not like all the coughing that comes with these respiratory infections, medicines containing expectorant can help us cough better, supporting our body's natural defense system, the lungs.
When we return, a look at new solutions for heart patients. We'll explore the benefits of high-tech pacemakers and home test kits that can make life easier for people on blood thinners. Today's Health continues in a moment.
As we grow older, it's important that we consult with our physicians to determine if we are candidates for potential health risks. Discovering what these risks are early enough can give us more options in dealing with future health challenges.
Heart doctors are essentially either plumbers or electricians. Invasive cardiologists are typically plumbers, involved with valves, clogged pipes, or pumping actions. Heart electricians are known as electrophysiologists.
The heart has an electrical system through which electricity flows, which helps the heart maintain its heartbeats. If there is an abnormality in the heart's electrical system, that can lead to heart rhythm disturbances or arrhythmias.
Atrial fibrillation, or AF, is a common heart rhythm disorder caused by an electrical conduction problem. AF is the most common rhythm disorder in the world, and it's associated with an increased risk of stroke. By itself, it may cause mild or no symptoms, or in advanced cases, severe symptoms such as dizziness, palpitations, and even fainting.
AF occurs more often in older people, so as our population ages, doctors see it more frequently. The condition generally doesn't go away. Instead, it gets worse over time. Doctors can pinpoint these defective pathways and remove small amounts of heart tissue using traditional surgery or lasers. Other therapies for treatment of this type of cardiac rhythm disease include catheter mapping and ablation, and implantation of pacemakers or implantable defibrillators for long-term arrhythmia control. Today's pacemakers, in contrast to the first device implanted in 1958, incorporate aerospace and computer technology. They feature advanced circuitry and sensor capabilities, contain up to 500,000 transistors, and are about the size of a $50. These modern pacemakers closely match the heart's electrical conduction system, not only saving lives but improving the quality of life for millions of people. An exciting new development is software which can be programmed directly into pacemakers to help control AF. It's called the AF suppression algorithm.
The atrial fibrillation suppression algorithm is designed to prevent atrial fibrillation from occurring before it starts. What's nice about the algorithm is that it matches the patient's heart rate and activity. If, for example, the patient is sitting around watching television and has a slow heart rate, the pacemaker only needs to pace slightly above that rate to keep the atrial extra beats from occurring. If the patient then begins strenuous activity, the pacemaker speeds up appropriately, again ensuring that the patient is continuously paced and that there are no extra beats leading to atrial fibrillation.
This technology can be important to people who already have pacemakers. About half of all pacemaker patients have or will develop AF.
AF suppression offers new hope to pacemaker patients suffering from atrial fibrillation, and even for those pacemaker patients who have not been diagnosed with AF. The algorithm is built into the device and is ready should this condition ever develop.
When faced with chronic illness or long-term care needs, it's important for people to be informed about all of the available options. As our next story shows, for those dealing with these issues, help is available.
Blood-thinning medications, or anticoagulants, have helped millions of people with artificial heart valves, atrial fibrillations, and other circulatory problems. But people taking these drugs must strictly monitor their blood chemistry, or serious complications could occur.
Anticoagulant therapy can reduce the chances of heart attack and stroke and cut down on hospitalizations and ER visits. Even so, physicians are sometimes reluctant to prescribe them because patients must be aggressively monitored. If not properly controlled, anticoagulant therapy can cause life-threatening side effects, such as internal bleeding. Many drugs and even foods can cause adverse reactions when combined with anticoagulant therapy. Patient compliance with the therapy is of particular concern. Physicians report that patients miss critical blood tests because of a variety of reasons. They're out of town, must drive long distances, or in the case of children, they have school conflicts. The standard testing process itself can be painful and time-consuming. A doctor takes a blood sample from a vein, sends it to a lab, waits for the lab work to be done, updates the patient's chart, and finally calls the patient with results and recommendations. Fortunately, today there are new strategies for managing anticoagulant therapy. One system allows patients to actively assist in their own care by performing blood tests at home.
Patients used to have to go to the doctor's office to get their PT checked. Now it can be done very simply, quickly at home, without any problems. The method to check it can be done with ease. It takes just a few minutes to teach the patient how to do it, and then they can do it at home anytime they please. The method is a simple needle stick. The drop of blood is put onto a disc that goes into the machine, and the result is reported to the patient immediately. If it's out of the range, the patient can call their physician and get instructions.
Patient self-testing is available for patients on warfarin or Coumadin therapy. The test is a simple 4-step process. The patient inserts a test strip, pricks a finger, places a blood drop on the strip, and waits 2 minutes for results. The system's automatic calibration checks for consistency and reliability. In many cases, the cost of managing this health problem can be reduced because fewer major events such as strokes or heart attacks are likely to occur with consistent testing. Recently, Medicare announced they will cover patient self-testing for patients with mechanical heart valves.
Doctors stress that in-home tests must be combined with periodic in-office visits and patient consultations to achieve the best quality care. The great news is that people on blood-thinning medications can now enjoy more control over their own health care.
Severe backaches are a common and often debilitating problem. Now, a revolutionary procedure is providing quick relief for certain types of chronic back pain. Find out how when Today's Health continues.
Every day, it seems as though we're on the verge of a new era in healthcare. As we're about to see, one new breakthrough in the field of health is having a positive impact on people's lives.
Amy Lee Collins is a medical student from West Palm Beach, Florida. She's young, healthy, and enjoys a normal, active life. But 6 months ago, her life was an agonizing nightmare that she thought would never end.
It felt like knives were sticking in my back all the time, and someone was jamming a fist into my lower back. I couldn't walk, I couldn't run, I couldn't exercise, I couldn't lift anything, I couldn't sleep.
Amy's life was turned upside down when she began experiencing pain caused by a common spinal condition known as a contained herniated disc.
In between the vertebrae and the spine are small discs that act as shock absorbers. These discs are made up of a soft inner nucleus and protective outer layer called the annulus. Factors such as excessive pressure or even just the normal stress associated with aging can cause the disc to weaken and bulge outward, causing irritation to surrounding nerve tissue. This can cause mild to severe pain in the lower back and legs. Now, however, new hope has arrived in the form of a unique outpatient procedure called disc nucleoplasty.
It's a quick operation. It only takes about 20 to 30 minutes. The patients respond very positively. They're usually walking out of the surgery center within an hour of the procedure. We've only been doing it for the past year or two, and we've already seen great successes.
Disc nucleoplasty is a relatively simple procedure. A catheter, which is a tube, is inserted into the disc. This allows a small radio transmitter to be guided to the target area. The transmitter emits special radio waves which decrease tissue volume. This takes place without causing damage to surrounding tissue. This procedure decompresses the disc, allowing the herniated portion of the disc to go back into its normal position, away from the nerves in the spine.
Disc nucleoplasty is a significant advance in the treatment of patients who have low back pain. It's an option that doesn't prevent any future treatment that could be available to the patient, and it's perfect for those that would not otherwise be candidates for open surgery.
Since the surgery, I've been able to do so much more than I could before. I mean, the simple things that people take for granted, like being able to walk the dog to the corner and back and not be in pain, being able to sleep through the night. I think the surgery was one of the best decisions I've ever made.
Amy is now enjoying a normal life thanks to disc nucleoplasty. If you or someone you know is suffering from lower back pain, consult with a physician to see if this procedure is right for you. For more information on disc nucleoplasty, you can log on to www.nucleoplasty.com.
No one should have to suffer from chronic pain. Now, with new advances in medical technology, many people suffering from lower back pain can look forward to a brighter future.
Feeling great and maintaining good health are goals that we all share. We hope today's show has helped you in some way to realize those goals. If you'd like to know any more about the topics presented on today's show, log on to www.vstar.com for up-to-the-minute information about matters concerning your health. For everyone that helped make this show possible, I'm Chris Everett saying thank you and asking you to join us next time on Today's Health, the show that gets right to the heart of matters concerning your health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.